Hi, everyone. Sorry for the delay. Thank you so much for joining us today. My name is Rhea Racho. I'm the Public Policy and Program Manager for the Hepatitis B Foundation. And I want to welcome you to today's webinar on Just B, real people sharing their hepatitis B stories. I'm going to start things off just by going over a few logistics and details about how you can participate in the discussion today. So first, if anybody is experiencing any audio issues through your computer, there's also a call-in option that you can see here on the screen. Please note that all attendees are in listen-only mode and you'll be muted throughout the presentation. But if at any time during the presentation you have any questions, you are welcome to submit them by typing them into the question box in your GoToWebinar control panel. We will be reviewing these as they come in, and we'll address as many questions as we can during our Q&A time at the end of the webinar. And lastly, please note that this webinar is being recorded. You will receive an email with a link to view and share the recording after this webinar. All right, so today's webinar is being co-hosted by Hep B United, the Hepatitis B Foundation, and StoryCenter. Hep B United is a national coalition that was co-founded and co-chaired by the Hepatitis B Foundation and our partner, APCHO, the Association of Asian Pacific Community Health Organizations. Hep B United is dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities across the United States. Hep B United is comprised of more than 35 members across 18 states and the District of Columbia, and we represent a variety of sectors including health clinics, local and state health departments, community-based organizations, and academic and research institutes. The Hepatitis B Foundation is a national nonprofit organization dedicated to finding a cure and improving the lives of those affected by hepatitis B worldwide. And StoryCenter is a nonprofit organization that supports individuals and organizations in using storytelling and participatory media for reflection, education, and social change. Here is an outline of today's webinar and what we will be covering during our presentation. So first, I'm going to provide a quick overview and some updates on the Just B campaign. Next, we'll have Amy Hill with StoryCenter talking more about the work of their organization and about their digital storytelling methodology, which is what has guided each of the Just B workshops that we've coordinated with them. And last but not least, we'll introduce three of our newest storytellers and share their videos and then open it up for Q&A. So first, the overview and updates. I wanted to start by providing some quick background about hepatitis B to underscore the importance of why this storytelling campaign is so important and unique. So you may be familiar with most of these statistics, but in the United States, it is estimated that more than 2 million Americans are living with chronic hepatitis B infection, but only 25% are aware that they're infected, and less than 10% of individuals living with hepatitis B are able to access care and treatment for the disease. At the same time, hepatitis B has historically been a forgotten and under-prioritized disease in terms of there not being enough funding for prevention programs and not enough funding or prioritization around research for a cure. And then there's also such a lack of awareness and this lack of urgency to take action to address the epidemic. Additionally, we've seen that hepatitis B can be a highly stigmatized disease, and this is particularly common in many of the communities that are disproportionately impacted by it, and that includes Asian Americans, Pacific Islanders, and African immigrant communities. And so unfortunately, because of all this and other barriers that exist, most infected individuals are not diagnosed and do not receive the care and support they need to live long, healthy lives. People living with chronic hepatitis B, especially if left untreated, are living with an increased risk of dying prematurely from liver failure or liver cancer. So how does that all tie into the Just Be campaign? And in all of the work that the Hepatitis B Foundation and our partners do across the country, one thing that often seemed to be missing were the voices of people directly affected by the disease. So we felt it was really important to start collecting and sharing the true personal stories of people who are living with hepatitis B or have family members or loved ones who are affected by the disease. And we wanted to use storytelling to help address this significant lack of awareness, to help combat the stigma associated with it and that fear of discrimination that hepatitis B patients often face. So that's what we did with the Just Be campaign. As you'll hear more from Amy, we partnered with StoryCenter on this to create and share digital stories from people across the U.S. who've been affected by the disease. We launched the campaign officially in May of last year, 1 year ago this month, in partnership with StoryCenter and APCHO. And the project was made possible by educational grants from a few of our corporate partners. And to summarize the goals of the campaign, they are to increase awareness and advocacy around hepatitis B, to decrease stigma and discrimination associated with the disease, and to help promote testing, vaccination, linkage to care, and treatment to help save lives. And then here is a quick overview of our Just Be campaign activities to date, and I'll talk a little bit about how we're disseminating the stories to the public. So far, we've coordinated 3 workshops, all facilitated by StoryCenter, and we've produced 22 digital stories so far, and we're proud to say that 13 of those are available in 2 languages. So many of our storytellers coming from the Asian American or African immigrant communities were able to record their stories in English as well as a second language, which has been really helpful for us in doing outreach to communities who speak those languages. So the languages that we have included in the campaign so far are Mandarin and Cantonese, Korean, Vietnamese, Tagalog, Khmer, Twi, and Yoruba. So we launched the website for the Just Be stories just last year at hepb.org/justbe. That's the main campaign website where you can find everything, including some accompanying resources like our discussion guide that goes with the stories. Also, among our project activities, an ongoing thing that we do is that we maintain relationships with the storytellers after the workshops that they participate in. So we provide engagement and speaking opportunities depending on their interest and their availability. We reach out whenever there are opportunities for a patient advocate or a family member to speak at events or share their story in other outlets besides just their video. So we provide those opportunities and ongoing training and support. And then internally, the Hepatitis B Foundation is working on evaluating the program and the impact that this whole project has had, not just on the people who've participated, but also the people who view the stories. So we wanted to look at what kind of reach the stories have, and if they're, we wanted to collect the feedback from people and get people's reactions to whether it's really helping to increase awareness and break down the stigma. We also, here on the right side, is just an overview of how we're disseminating the stories nationally and locally. So we do feature a different story every month in our newsletters, on our website, on social media, and that is just because all the stories are available to view at any time, but we highlight a different one each month just to give it more attention and to highlight key points within the stories. We've done media outreach, including press releases, and set up interviews. There has been some local news coverage and coverage in ethnic media outlets. We've submitted guest blogs to different organizations just to help spread the word about the campaign. We've had several advocacy events over the past year, including a few issue briefings for congressional members and their staff. And then we've also had face-to-face meetings with congressional offices where if a storyteller is there in person, obviously they meet with their representative, or we've shared written materials and the anecdotes that we've heard from our storytellers. We share them with their respective representatives just to illustrate how hepatitis B impacts people in their communities, and that has been highly effective advocacy strategy. We have also shown the stories at conferences. We've submitted to film festivals. We've partnered with local organizations to start hosting community screening events or forums about storytelling. And then we have printed materials, including postcards and posters that highlight individual stories, and they've been great handouts to bring to big events. And then this slide is just a collage of pictures I wanted to share. We have so many events that we've been able to engage our storytellers in over the past year. So this is just a sample of different things. Some of them are here in DC on Capitol Hill. We've had a storyteller attend a movie night at a Prevent Cancer Foundation conference. We had storytellers attend the Hep United Summit and speak in front of our partners. The one on the right is a congressional briefing. And then the two in the corners there are just a couple of examples of our storytellers being featured in media and also on partner organization websites, including shotbyshot.org. So I just wanted to show a little bit of that. So our storytellers remain very engaged and active and great to work with even beyond the workshop. All right, so that is the summary of just an overview and updates on the campaign so far. But now I want to turn it over to Amy Hill from StoryCenter. StoryCenter, as I've mentioned, has been our partner throughout this whole thing, and they have really guided the production of the videos that you guys see on our website and facilitated each one of the workshops. So Amy will be talking a bit about that, an overview of digital storytelling and the work that their organization does. I'll pass it over to Amy.
Great, thank you so much, Rhea. Hi, everyone. Thanks for joining the webinar. Rhea, feel free to interrupt if anything isn't sounding audible. So just a tiny bit of background about me. I've been working with StoryCenter, formerly the Center for Digital Storytelling, for more than 15 years now, which seems completely crazy. I co-founded our Silent Speaks initiative, which looks at the role that personal storytelling and participatory media can play in public health and gender equality and human rights education and advocacy internationally. And I currently also help lead many of our public health and social justice efforts here in the U.S. So, are you doing the slides? I'm assuming you're doing the slides. Rhea?
Yeah, I can advance them for you.
Okay, yeah, so we can go to the next one, I see. So moving on to just a little bit of background on StoryCenter. We are a nonprofit organization that has been around for well over 20 years at this point, and we've trained literally thousands of people around the world from all walks of life and cultures, speaking many, many different languages. And our work was originally born out of an impulse and a desire to democratize artistic practice, basically to displace the active media production from a more professionalized realm into a truly accessible and community-based realm, so that everyday people can have the experience of sharing and witnessing compelling and meaningful stories from their own lives. So We have up on the slide just a few of the things that we do, and the main emphasis, as under the second big bullet point there, is on first-person stories told from people's own real-life experiences, as well as production processes that involve groups of people in creating media, and then, of course, the participatory piece, where we guide people through the production of their own story. All right, I think we can go to the next slide. So just a quick overview of what digital storytelling means to us at StoryCenter. As people are probably aware, the term digital storytelling is currently used to refer to quite a wide variety of media production practices, or you could say different approaches to making media. And as far as we know, our director, Joe Lambert, and his colleagues actually coined that term way back in the early 1990s when the first digital video editing software came out, and they first began doing digital storytelling workshops and beginning to develop the curriculum that we still use today. So for our purposes at StoryCenter, digital storytelling, as I said, is a participatory process that brings together small groups of people over the course of several days to share in a carefully facilitated workshop environment personal stories from their own lives, and then work with our facilitators to develop these stories and audio record them, select and generate images to illustrate the stories, and either learn through simple computer tutorials how to edit the materials into short videos, or consult on the video editing and storyboarding. Just in terms of briefly kind of theoretical underpinnings, the focus on group process is really key to our approach, and that's really rooted in the popular education pedagogy of Brazilian educator Paulo Freire, who I'm sure many people on the webinar are familiar. And he really believes that the development of critical consciousness, which he saw as a necessary precursor to any kind of action for social change, needs to begin with close examination of one's own experience and how one's own experience is located within a particular social and political environment, and what the elements of injustice are in the environmental context. And so these ideas have been really relevant in the context of our public health work as we support storytellers in pointing to their individual experience and also to the broader social context in which that experience unfolds. And then, of course, we also draw on oral history and participatory media approaches. And so I guess in summary, for us, digital storytelling is not simply a communications materials development method. The actual process of creating stories is always prioritized just as much as the production, and in terms of what that process does and how that can really support storytellers. And I will leave it at that. I think we can go on to the next slide. All right. So for the partnership with the Just Be initiative, as Rhea said, we've so far done 3 digital storytelling workshops, and we have a 4th coming up in DC in July, which is super exciting. And we've worked together with the Hepatitis B Foundation and their many national partners on identifying and recruiting storytellers, and also on really designing follow-up processes around preparing storytellers to share their stories and developing resources and tools to support that sharing. So this webinar is actually an example of that, and I'll hurry up so we can actually get to the storytellers who are going to share, because I'm sure they have a lot more interesting things to say than me, but just to give a tiny bit of detail on the actual workshop process. So the initial focus of a workshop is really on supporting storytellers in identifying what story it is they want to share, And so we do this by showing examples of stories that have been made in previous workshops, and then going over our core curriculum on the 7 steps of digital storytelling, which really helps people think about how to approach crafting a short story from their own life. And then we also, in the case of projects like Just Be, work with very specific story prompts to support people in really zeroing in on particular aspects of the issue at hand. And then comes what is really the heart of the workshop. So on the slide where it says agenda, this is the story circle. So this is when people take turns verbally sharing their stories and receiving input and feedback from their fellow participants and facilitators. And then next, people develop short written scripts and audio record those, and they are developed based on feedback from the story circle, as well as one-on-one conversations with facilitators. And then just to say, for people who aren't comfortable as writers, or if we're working across languages, we support this scripting process by documenting what people say. And then also for recording, we don't typically use video cameras, as people sometimes get nervous when they're being filmed. Instead, we just use simple audio recording equipment as might be used for recording a piece for radio or podcast. Then the next phase of the workshop focuses on gathering and creating images and editing. So as facilitators, we help storytellers look through images they may have brought, and then we talk with them, if they don't have many images, about what kinds of photos or video clips we can take to illustrate the story. And then we guide people through a simple hands-on video editing tutorial to show them what they need to know to piece together a rough draft of their story. And then we always end the workshops with a screening of the stories. And this is a really wonderful way to bring closure to what unfolded over the course of the workshop. And then after the workshop, we do post-production work on the stories to polish and finalize them. So that is what I have in terms of about the workshop. So I think, Rhea, I can give it back to you to turn it over to the storytellers.
Yes, thank you, Amy. And just a reminder, if anybody has questions for Amy or for any of the presentations so far, feel free to enter them into the chat box, and we'll answer those questions at the end. So first up, we would like to share Nancy's story, and I'm going to see if we can take Nancy off mute for a minute to just say a few words about what made her to decide to participate in the workshop. You can introduce yourself, and then I'll play your video. Oh, I think Nancy might be muted still from your end. Hello? Okay. Well, I'll go ahead and play Nancy's video. I think maybe she's reconnecting. But Nancy participated in the January 2018 workshop, so she is one of our newest storytellers. And let me switch to her video. So you should get, if you're connected on the computer, you should get a screen that's about to pop up, and I'll play that.
Good morning, Dad. The other day, Mom and I looked through some pictures of you. You immigrating here to the U.S. in the mid-1970s. getting your degree, and buying your first car. Then Mom looked down suddenly and sighed. She said, "It was too early for him." My daughter, your granddaughter, was helping to interpret for Mom and me. She interrupted and said to me in English, "I don't think Grandma wants to talk about Grandpa. Why do people have to die?" We cried together. I remember that day so clearly. I had just graduated, and I'd done what you wanted, gotten a job in D.C. working for the government. You called me and said, "Come home,"
Hello, can
or
anyone
"Pali
hear me?
jibewa." What could be so wrong that you wanted me to come home permanently? The first time we heard the words terminal illness from the doctor, we didn't understand what they meant. We tried to find a hospital that could treat you, but it was too late. The liver cancer had spread all over your body, and there was nothing else we could do.
Hello?
You lost your appetite. We had to take you to the doctor to drain your stomach of fluid buildup. Your sister was so upset. She said to you, "If you are so educated, why were you not smart enough to ask for a blood test? How could you not confirm what was going on with your health?" To this day, we are not sure how long you have been living with hepatitis B. After you passed, we found boxes of medication prescribed to you for stomach indigestion. I am sure that was not treatment for hepatitis. Sometimes I think about what could have been if we had found out early. We could have gotten treatment to save your life. I miss you, Dad. Just be tested.
Okay, so hopefully that worked from your end. I just played Nancy's video. If there are any issues, feel free to type in the question box if you aren't able to see that, but also we'll share the links out and you can check our website for these videos if there are any technical difficulties. But now I do think I could hear Nancy a second ago. Are you connected now, Nancy? Okay, sorry everyone. We'll pause again. I'm gonna play another video real quick, and then we'll get back to everyone. Will have a chance at the end as well to be off mute. But right, I'm gonna show your video next. If you want to come off mute and introduce yourself, and maybe say a little bit about what made you decide to participate in the Just Be campaign, in the workshop.
Okay. Hello, everyone. My name is Brian. Actually, I did decide to participate in the storytelling workshop. So after my diagnosis, I began to think about how I could get involved to prevent another child from getting the infection from birth. So with thinking and all that, finally, I found out that I could use through storytelling, I could get in touch and I could kind of get to a lot of people that way, connected to a lot of people that way through storytelling. So that is why I decided to share my story with other people to make sure that no innocent child ends up getting this virus and at the peak of their life have to struggle and battle with this virus and society just to get heads up of life. So that's the reason why I decided to join the workshop.
Great. Thank you, Bright, for sharing that. I am now going to pause here and play Bright's video. So another window should pop up now in just a second.
I was born in a small town in Ghana. My family was not wealthy or powerful, but my mom cared for me and my 4 brothers. We loved her special pancakes made with nutmeg and fried in coconut oil. Somehow, I managed to finish teacher training college, won the American visa lottery, and emigrated to the US. I was shy and quiet, but I thought of myself as pretty strong and resilient. Life had not been easy. 5 years later, I learned that my mom had passed away back home. All of my earlier strength and resilience fell away. I couldn't concentrate. I wanted to hide from the world, and sometimes I didn't want to live anymore. My friends helped me so much. They said, "You loved your mom. She would not be happy seeing you give up on your life." So I got some counseling and I got a little stronger again. But then I started feeling tired all the time. 4 or 5 days a week, I had absolutely no energy. My doctor helped me, and eventually I learned that I was living with chronic hepatitis B. I started treatment, but the fatigue and back pain got worse. Were they connected? Every morning, I woke worrying about my future and what will happen next with my hepatitis. I might be okay today, but what about tomorrow? Or next year? Or 5 years from now? Slowly, I started to have days when I wasn't hopeless, when I could face the unknown. I talked to my doctors, did my own research, and made my own decisions. A year later, my brother came from Ghana and I picked him up from the bus station. After a moment, he said, "You have changed." I couldn't imagine what he saw so quickly in me. But now I realize I have changed. I am more resilient than ever before. Just be resilient.
Okay. I also wanted to point out before I play this next video that Bright's story and Nancy's story, we actually also had the opportunity through StoryCenter to be connected to a musician named Joe Kai, who actually contributed original music for both of those stories. And so you may have noticed at the end of the video that his name and website appeared at the end of their videos. And we also have a link to his website from the Just Be campaign website if anybody's interested in learning more about him. So next, and our last video to share before we get to the Q&A is Alice's story. And Alice, I'll let you take a minute to introduce yourself and also talk a little bit about why what made you to decide to participate in the Just Be workshop?
Thank you, Rhea. Hello, everybody. This is Alice, and I am from Sacramento, California. I work for the California State Department of Healthcare Services as a nurse manager. I oversee home and community-based programs for the last decade. So I really enjoy what I've been doing and still have very close in touch with the community. So my background experience is a registered nurse. And I have been a community volunteer to promote hepatitis B prevention and education since 2000. So my passion of hepatitis B prevention continues. So by the time I was offered the opportunity to look into the participation in the storytelling workshop, so I feel like the video production for this workshop probably can be a very effective tool to educate the community, since it comes directly from people like me who is infected with the disease. So I kind of like at first, I debate think about it for a few weeks, before I actually commit myself to the workshop. And because stigma is something, I still have to overcome, like Ray was talking about, hopefully the campaign will reduce the stigma. So, but in another way, I feel like the workshop, to produce the video will bring more meaning to my personal level to promote the hepatitis B prevention. And then hopefully that it will further reduce and eventually eliminate the hepatitis B virus infection via the perinatal transmission. So I'm grateful to be here. Thank you.
Thank you, Alice. I'm going to pull up her video so you can learn more about Alice's story now. Here we go.
I remember my mom always telling me, don't ask, don't tell, in regards to illness. For my Chinese family, being sick is a taboo, so we never talked about it. When I became pregnant with my first child, I find out I have hepatitis B. I was very shocked. Only then did I learn from my mom that she also has chronic hepatitis B virus, and that I probably got it from her. I know the transmission wasn't her fault, and yet I wish she had told me sooner. I decided I wanted to do motherhood differently. I was blessed because my OBGYN knew what to screen for and took precautions to prevent transmission from mother to child. My 2 children got vaccines at birth and then completed the 3 shots afterward. When they were retested at age 1 and again at age 2, the test came back negative. But my doctor told me that because I have chronic hepatitis B, I have a 25% chance of getting liver cancer. Will I be able to see my children grow up to adulthood? Will I have to leave them too early? I chose to be very open with my children about the virus. And I started reaching out to Asian communities too. When my children attended Chinese language school, I set up a hepatitis education booth for parents. My children manned the booth with me and talked to their friends about vaccination. Later, when they left home for university, they continue doing hepatitis B outreach on their own. I did too. I remember my son coming home during a school break and saying, "Hepatitis B is a silent killer. Testing is so important, and vaccination can prevent the infection." I told him, "You got it. I am so proud of you." I used it to think my passion for preventing hepatitis B would live in me until I die. Now I think it will live longer than that. Just be grateful.
Okay. So those are the three stories that we were going to share today. And before we get to the Q&A, I just wanted to thank all three of them again for participating in the workshops. And as you can tell, in just a few minutes within the video, they're only about three to 4 minutes long, and they're able to share a lot of personal information. And I think that the willingness and the bravery to be able to speak out about hepatitis B is so important, and we are so thankful that we were able to work with each of them to create these videos and help bring awareness to the issues that people face who have hepatitis B. So now we've reached our Q&A time. Again, as a reminder, if you have other questions, feel free to add them, type them into the chat box. I have a few to start things off with. So if Alice, Bright, and Nancy, if you just want to stay off mute now, that's fine. So the first question is, what do you hope people will take away from watching your story? And what types of changes do you think you'd like to see as a result of the Just Be campaign overall?
Okay. From my point, what I want people to take away from watching my story, it's I just want people to realize that hepatitis B virus is real and it does really affect human beings. I know there are people who are skeptical when it comes to this virus. Some think it's something that is from somewhere else, or they have this superstition that is some witches or wizards who bring this on other people and stuff like that. That might be true, but in my instance, I don't think that was the cause of it. The cause of it was I got it from a person. I got it from my mom. So, and it's real. It's there. It's something that exists. So there is no denial about it whatsoever. But I would say I just want people to know that yes, having hepatitis B virus, it's more like a death this thing on the individual, but it shouldn't be a death penalty on you, because there is hope and there is a lot of ways you can get treated if you need treatment. And if you don't need treatment too, and you need to protect yourself, there is vaccine which can protect you for the rest of your life. So there is great way out of it, and it shouldn't be a death penalty like it sounds most of the time. So all that I want people to take from it is to know that hepatitis B is real and it does really impact people, just like me and like others, which is real too. And know that there are options out there to save their own lives and that of their family members. So nobody should count themselves out. It's not too late. There is always a way out. So just get tested if you haven't done that. Get vaccinated if you haven't done that. And if you need a follow-up, if you are chronic, continue to follow up with your doctor to make sure everything is all right with you. As time goes on, you continue to do the right thing and you stay away from alcohol and anything that will cause more trouble. Just try and stay away from it. That's all I want people to take away uh, from this. And I just want people also to have a little bit of open-minded, especially with we those of foreign heritage. Like I said, I mentioned earlier, we do have a lot of superstition, but I want us to be open-minded. Yes, the superstition might be true, but when it comes to diseases and infections, a lot of them are real. And so instead of trying to prevent us from moving forward, seeking help, we should rather be open-minded about it and push to seek help and seek treatment. Because a lot of time we die from sicknesses or illnesses that are not supposed to kill anyone, but we die from it because we don't do anything about it because of our beliefs and our superstitions about the specific disease. So I just want people to be open-minded and rather seek help than just quell back in their shelves and do nothing about it till it's too late and there's nothing that can be done for them.
Thank you, Bright. Oh, yeah. Thanks. Go ahead, Alice.
Okay. I echo Bright's comment. That is very true. So as you can see on the video that I have emphasized, one thing is on the screening, testing, and the vaccination. And they are very crucial to prevent the hepatitis B virus. So also I want to stress it is important that as knowledge is power, the campaign, I think it will empower the individual and the community to know more about HBV. And with us being the real people that sharing the story, and I hope, that will, like what Bright was talking about, to open up and start talking about it. And I hope that, that will really decrease, the campaign will decrease the fear of talking about the hepatitis B and be able to reach out for help on the screening and vaccination. So I still feel like that hopefully, in the near future, with the campaign, people can talk about the HBV naturally and also casually. Back to you, Rhea.
Thank you, Alice. Is Nancy, were you on? I just wanted to check. Okay. So I have another question. Before I read that question, there's also a comment that I wanted to share from someone, an attendee from last week's Hep B Coalition Forum in Washington State. Alice and Bright were actually at this event in person, and so a commenter from the audience just wrote that I had the privilege to meet Alice and Bright at the Hep B Coalition Forum last Thursday in Washington State. Thank you for coming to speak at the forum. So I just wanted to highlight that for you guys. And then another question for whoever wants to answer is, could you talk a little bit about what it was like to participate in the story circle and sharing your story with others and, being around other people who have had similar experiences, or, if you learned something new about hepatitis B, just the experience of sharing at the workshop.
Okay. So I would say like Alice, I never really talk much about my status with hepatitis B. It's just a few friends and a couple of family members who knew about it. It was not something I really talk about it because of the stigmatization that is out there and just people taking things out of context and just making it even worse for me. So I never really talk about it in a group setting or in a formal setting, to be precise. So to me, it was more of, at the beginning, it was a little bit I would say I was I wasn't really up to it, but I would say after hearing a couple of people talk about their experience with hepatitis B, I think I got some boost and a motivation to share mine because I realized I wasn't alone, especially in that room. I felt like uh, I had a family. I belonged to a certain family that I just found, and we are different in different way, but we have come together because of one issue, and that is hepatitis B, which is very common to all of us who have gathered there. So around the table, I think I was able to get some strength and motivation to be able to share my story, and I thought that was a very interesting experience, if you ask me. And it was easy for me to open up and talk about it like previously I hadn't done before, and so I thought that was cool.
Um, for me, participating in the workshop, the story circle time, I feel like it's the best thing that I have done in the workshop. It's somehow like what Bray was talking about, that for so far since I am living with the Hep B, I not really open myself, to the public, talk about my experience other than just my family members. So when I was there, I kind of like, I don't know what to totally expect what to do, but somehow when on the second day with the circle time, I feel because Amy and her staff create such a comfortable and trustful environment, make me feel kind of like open and feel really trusted, people around me. So I was able to open up, to talk about my experience, my fear, everything, in this, a group setting of this a circle. And the staff, all the supporting staff and Amy, they are very supportive. And everybody hear each other's story. We cry, we sob, and it's something I feel like, yeah, the StoryCenter, did a great job to promote, this comfortable environment for us to share the story. I think that is the best part of being the participant in the workshop.
Thank you for sharing that, Alice. I think that was a really great positive note to actually end the webinar now that we're on exactly 4 o'clock. I don't know if people had other questions or comments. You can feel free to reach out to me. But I know I don't want to go over time, so I just wanted to thank everybody for joining. Feel free to connect with Hep United, Hepatitis B Foundation, and StoryCenter. Our websites and our Twitter handles are now up on the screen. But I just wanted to thank Amy again for joining and presenting, and our storytellers. Thank you not only for being on today's webinar and for sharing your thoughts about the process, but also for continuing to be engaged beyond the workshops and for being willing to share your stories so publicly when this is when we know that this is an issue that is hard to talk about sometimes. And we are excited to see where the Just Be campaign goes, and we're glad. We know that the more people that we add who are willing to share their stories, I think it'll really inspire other people, like you guys were all saying, inspire other people to feel more comfortable and to help break down the stigma and increase awareness around hepatitis B. So we really appreciate your involvement. I just wanted to remind everyone to check out hepb.org/justb to see the other 4 brand new videos that were just posted. And if this is your first time hearing about the campaign, there are more than 20 videos total on the website that represent a variety of different backgrounds and people who have been impacted by hepatitis B. So we would love for you to take a look and share the stories. And if you have any questions, please feel free to reach out to us. And again, the recording for this webinar and the slides will be shared after this call. So thank you all again for joining, and have a wonderful rest of the day.
Thanks, Rhea. Thank you, everyone.
Thank you, Amy.
Thank you.
Bye, everyone.
Take care.
Thank you. Bye-bye.
Bye.
Bye.
Thank you.